Up to 500 people are preparing to receive their first dose of a COVID-19 vaccine in Toronto today, with more shots rolling out in Ottawa and Quebec. Ontario Premier Doug Ford says this is the beginning of the end for the virus.
Make no mistake, there's a long road ahead of us, but what this represents is hope and proof that this pandemic will come to an end. God bless.
So overseeing the vaccination effort in Toronto is Executive Vice President of Science and Research at the University Health Network, Dr. Brad Wouters, and he's joining us this morning. Good to speak with you.
Good morning, Anne-Marie.
How are the people who received the first vaccine on Monday doing at this point?
Well, everyone's doing well. We had a very exciting day yesterday. We had 5 healthcare workers from the Rakai Centre, a long-term care home here in Toronto, who've been at the front line since the beginning of the pandemic. And they were anxious, a little bit nervous, but we had all 5 go through yesterday without any hitches.
We know priority is being given to frontline healthcare workers, but who's in the next category?
Yeah, healthcare workers are at the top of the list, particularly those that are at the front line, that are working in centers that have outbreaks and have patients at risk. Our elderly population, individuals that are at risk of the disease, that may have other kinds of ailments and so on that make them at high risk. And this has been outlined in detail by the provincial government. They've created a priority list for vaccination, and that will happen as vaccines become available.
So Pfizer's vaccine, we know, needs to be stored between -60, -80 degrees Celsius, and that, of course, is creating challenges for large-scale distribution, not just in this country, but other countries as well. What is the plan to address that? How are we going to get more of the vaccine to people in more remote areas?
Yeah, this particular vaccine does have this more restrictive kinds of storage conditions, and it means that the vaccine needs to be stored on site, it needs to be prepared on site and administered on site. That does pose those challenges, but there are other vaccines coming. We're expecting the Moderna vaccine to be approved within the next couple of weeks and to be made available in a time frame not far behind this Pfizer vaccine. That has less storage restrictions and will make it easier to get this to more remote communities.
If I'm somebody in one of those remote communities, tell me if I'm hearing this correctly, then I will have to wait for the Moderna vaccine rollout and not be in part of this Pfizer vaccine rollout.
The Pfizer may eventually have logistics in place, have freezers in place in more remote communities to make it available too as more doses become available. But it's likely that the Moderna vaccine will be ahead of that, and the very first vaccines available to those more remote areas will very likely be that one.
Okay. Back to Pfizer. This is a 2-dose vaccine. So once that rollout begins to the public at large, what system is going to be in place to make sure that everybody receives their second dose? We know it's 2-part, to make sure that happens on time, and remind everybody of that time frame.
Yeah, it's 21 days apart for the Pfizer vaccine, 28 days for Moderna. So when patients register and they receive their first dose, that's recorded, and they will book an appointment 21 days later to come back for their second dose. Our distribution center at UHN has received 3,000 doses, and so we're administering, or aim to administer, 1,500 this week. The other 1,500 are being kept in reserve for that second dose.
So when can we expect the rollout of a vaccine to put a dent in the number of daily cases of COVID-19? This is what people want to know. From the time of the vaccine and we start to vaccinate people to those numbers going down, what's the time frame?
Yeah, that's what we're all really excited about, is how this will end community transmission and make it safe for everyone to go back to work and live a more normal life. That's going to take a while. Those at risk are being prioritized first to protect those individuals, but it's only once we reach 50 or 60% inoculation that that we have a chance of really achieving herd immunity and full protection. So that's going to take some time. Canadians are going to have to be patient, and we're going to need to continue to practice all the measures that public health and the authorities are telling us to do to be careful with our contacts, to physical distance, to wear a mask, to wash your hands, and to stay safe. But what's really exciting is that end is near. It's possible, and it's going to be a logistical challenge to get this to all Canadians, but it's a very exciting day for science.
Dr. Wouters, it is an exciting day, both in Ontario, Quebec, and across the country at large. Thanks so much for being with us this morning.
Thanks, Anne-Marie.
All right. Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.